Good morning, I'm Vic Senese with UroNurse News. You know the drill. Today's story focuses on a landmark study that directly compares two of today's most advanced surgical treatments for men with enlarged prostates, the WATER III trial Aquablation versus laser enucleation. For years, both Aquablation Therapy and laser enucleation of the prostate, commonly known as LEP, have demonstrated excellent outcomes for treating benign prostatic hyperplasia or BPH. But until now, these procedures had never been compared head-to-head in a prospective clinical trial. That's exactly what the WATER III trial set out to accomplish. So let's look at the study. Researchers enrolled 202 men with moderate to severe lower urinary tract symptoms and large prostates ranging from 80 to 180 milliliters. International multi-center study included both randomized and non-randomized participants. Ultimately, 186 patients underwent surgery. 98 received Aquablation therapy, while 88 underwent laser enucleation. Researchers evaluated how much urinary symptoms improved after 3 months using the International Prostate Symptom Score, or the IPSS. They also carefully monitored complications and overall safety. Now for the results. The primary finding: both procedures significantly improved urinary symptoms. Patients treated with aquablation experienced an average IPSS improvement of 12.9 points, while patients undergoing laser enucleation improved by 13.1 points. In other words, aquablation proved to be non-inferior to laser enucleation in relieving lower urinary tract symptoms. Now that's an important finding because it demonstrates that the newer robotic water jet technology performs just as well as one of the most established surgical procedures for large prostates. What about safety? Researchers examined complications requiring treatment or complications that persisted beyond 3 months. Complications occurred in approximately 41% of aquablation patients, compared to nearly 57% of patients undergoing laser enucleation. While both procedures were considered safe, aquablation again met the study's criteria for non-inferiority. So what's all this mean for clinical practice? Well, the WATER III investigators concluded that aquablation provides symptom relief comparable to laser enucleation, similar short-term safety, better preservation of ejaculation, and less persistent stress urinary incontinence during the short-term follow-up. Now, these findings provide important new evidence for clinicians counseling men with large prostates who are considering surgical treatment. Of course, longer-term follow-up will be important to determine whether these advantages remain durable over time. Now, here's the bottom line. The WATER III trial demonstrated that aquablation is not only comparable to laser enucleation for relieving urinary symptoms, it may also offer meaningful advantages for preserving quality of life after surgery. As additional long-term data becomes available, this study may help shape future treatment recommendations for men with BPH. I'm Vic Senese with UroNurse News. Thanks for watching, and see you next week for more updates on UroNurse News. But tomorrow on UroNurse, we're taking on one of the most frustrating complications men face after prostate surgery: post-prostate incontinence, and looking at a new approach that's getting attention. What if pelvic floor therapy could move beyond exercise and pads into a wearable, targeted technology designed to help restore control more efficiently? We're going to break down Ellatone for men, how it's intended to work, and what makes it different from traditional pelvic floor training, and where it may fit into a broader recovery pathway after prostate treatment. We'll also talk about real-world questions that matter: who might benefit, what does the evidence actually suggest so far, and what should patients realistically expect? So, tune in tomorrow on UroNurse.com at 9 a.m. Central Time for a closer look at potential breakthrough in managing post-prostate incontinence, explained clearly, clinically, and without hype. Hey, have a great weekend, everyone.
I'm Vic Senese for UroNurse News. Don't forget to like and subscribe. The experts' opinions in this communication are personal and not representative of any organization. They are for informational purposes only, not official guidance. Viewers are advised to use their judgment